Trauma stress versus hereditary ADHD dysregulation. Trauma. Trauma can come in the form of one traumatic incident, such as watching a horrendous crime scene, or complex trauma, where there's a repeated abuse of an individual, or even physical blunt force trauma, such as sustaining major injuries from a car accident. All of these types of trauma cause extreme distress in the body and our nervous system. It is never a simple just get over it scenario because, in part, your body's fight or flight response is impacted, and there can be severe prolonged dysregulation of the nervous system. ADHD dysregulation. According to Dr. Russell A. Barkley, ADHD brains have a tendency towards dysregulation, like a speedy car with poor brakes. Note, the analogy was first coined by Dr. Edward Hallowell. A quick Google search will provide for you a more scientific review and explanation, but for our purposes here, suffice it to say that dysregulation can and does cause physical stress on the body and social stress from trying to fit in. So, unlike trauma that can be healed, the tendency towards dysregulation with ADHD will always be there. So, it will always need your awareness to help prevent dysregulation or at least keep it in check. Therein lies the problem and confusion. This is why a professional needs to diagnose ADHD and rule in or rule out trauma. The symptoms can present the same, but the approach to healing will be much different. Furthermore, consider what happens when a child who has a genetic predisposition to ADHD, if he or she also experiences trauma. Conceivably, the ADHD symptomology would be much worse, compounded. This is also why it cannot be, and I repeat, cannot be a teacher or a random neighbor saying, oh, that kid has ADHD and needs meds. It is beyond the scope of their training and practice to diagnose a child, nor do they really know what is going on at home that may be exacerbating the child's symptoms. Goal setting. So, if you know that you are a victim of abuse or living in a constantly stressful and toxic home or work environment, the tasks you assign yourself might be straightforward. You might write your to do list. I will seek trauma counseling from a professional therapist or two, and or I will seek work that is less stressful, and or I will limit my contact with people who intentionally stress me and surround myself with more empathic people. You might also add, I will get a professional diagnosis. Or, if you can afford it, I will get a psych ed assessment to rule out autism or other disorders. Highly recommended. So, you may now proceed to any of the other lessons contained in this program. They are designed to provide you with insight as to why and where you may want to make some changes in your life. You should keep record of your efforts and goals, no matter how small they may seem. And remember, it is the cumulative total of all the little changes that will allow your body to shift and begin to regulate itself in a better way. Your body is always trying to maintain balance and regain balance and regulate itself. This is called homeostasis. So give your homeostasis a little help.